So Madeline, my daughter, was born with a brachial plexus injury. So the nerves in her right arm were damaged when she was born. She was not able to lift her right arm, move her right arm, or do anything with the arm.
The brachial plexus is a collection of 5 nerves that come out of the neck and provide all of the movement and feeling for the arm. The top 2 nerves, C5 and C6, primarily work the shoulder and the elbow. The bottom 2, C8 and T1, primarily work the hand and wrist, and C7 does a little bit of everything.
I came into the brachial plexus clinic with no experience, no knowledge of what the brachial plexus injuries were, and I was scared to death. I had no idea what was going to happen or if she would ever gain access to her right arm or anything.
Typically they're presenting with their elbow extended because they can't bend their elbow. Their shoulder is internally rotated, so they call this a waiter's tip posture. First thing we do is therapy for our children. That involves just passive stretching and making sure the arm stays limber and have good motion so that when the muscles recover, they have good motion to get into.
Our center is special because it is multidisciplinary. A team of professionals see every child at every visit. We do serial exams so that we can really accurately track progress. Non-surgical interventions for a brachial plexus injury include therapy and stretching and splinting. Sometimes the muscles that don't have nerve supply right after birth become tight, and so stretching of the joints is important to allow the babies naturally to recover.
In the more severe injuries, when the nerves are torn, they can have more permanent injuries and more permanent loss of function. And there are some babies where the nerves are actually torn apart from the spinal cord, and they can get no functional recovery on their own and need surgery to help.
One exciting differentiator for our program is that we are the only brachial plexus center at a children's hospital in this country that has a full-time dedicated basic science research lab devoted entirely to brachial plexus birth injury. Until we can cure this injury, and believe me, we're working to try to prevent it all and cure it all, but until we can do that, we need to maximize the outcomes, and that's the direction that's really guiding us in our clinical research as well.
We may see a child that isn't moving their arm at all at the time of birth, and then that changes and the child recovers hand, elbow, shoulder function and has function of that arm.
I'm from the Cincinnati area, so I grew up with children's, and having such a well-known, well-renowned Cincinnati, hospital, and having the access to all these doctors that they understand everything, they answer all my questions, and just having that is amazing. And I appreciate everything that they have given us and all the help that they continue to give us.